Tiny patients, immense needs. Compassion in neonatal care. Neonatal intensive care units, or NICUs, are places of both immense hope and profound vulnerability. Here, tiny newborns, some born prematurely or facing serious health challenges, fight for their lives. In this environment, compassion is not just a desirable trait, but a fundamental necessity. It is the bedrock upon which effective care is built, benefiting not only the fragile infants but also their anxious families and the dedicated healthcare professionals who care for them. Compassion in the NICU begins with recognizing the humanity of each tiny patient. These are not just medical cases. They are infants experiencing the world for the first time, often in a stressful and overwhelming way. They feel pain, fear, and discomfort just like anyone else. Recognizing this and responding with gentleness, empathy, and respect is paramount. Compassion also extends to the families. Parents of NICU babies often face a roller coaster of emotions: fear, guilt, helplessness, and overwhelming love. Compassionate care involves acknowledging their anxieties, actively listening to their concerns, and providing clear, honest, and empathetic communication. Finally, compassion is essential for the well-being of healthcare providers themselves. Working in the NICU can be emotionally demanding. Witnessing the fragility of life daily and supporting families through incredibly challenging times takes a toll. Self-compassion, as well as compassion from colleagues and the institution, is crucial to prevent burnout and promote resilience among these dedicated professionals. Compassion is not an optional extra in neonatal care. It is the very heart of it. It is the driving force that allows us to provide the best possible care for these vulnerable infants, to support their families through incredibly difficult times, and to create an environment where both patients and caregivers can thrive. Ami Bulsara, a beacon of compassion in the NICU. Ami Bulsara, a neonatal nurse practitioner, exemplifies the transformative power of compassion in the NICU. With years of experience caring for the tiniest and most fragile patients, Ami embodies a deep understanding of the profound impact that kindness and empathy can have on a newborn's journey towards health and well-being. She recognizes that beyond the medical charts and treatment plans, there lies a human story filled with anxieties, hopes, and dreams. Ami's approach to care prioritizes building strong, trusting relationships with families. She understands that parents are an integral part of the care team, and she empowers them to participate fully in their baby's journey. She patiently explains complex medical procedures in simple terms, ensuring that parents feel informed and involved in decision-making. Beyond medical expertise, Ami brings a level of genuine warmth and empathy to her work that is truly remarkable. She sees each baby as an individual, with unique needs and preferences. She takes the time to learn about each baby's personality, their likes and dislikes, and adjusts her care accordingly. Ami's compassion extends beyond the bedside. She is a staunch advocate for families, connecting them with resources and support systems to help them navigate the challenges of having a baby in the NICU. Her unwavering dedication to providing both exceptional medical care and heartfelt emotional support makes her a true beacon of compassion in the NICU. The ripple effect: compassion's impact on nurses and patient outcomes. Compassion in the NICU is not just about feeling good. It has tangible and measurable benefits for both patients and healthcare providers. Studies have shown that patients who feel cared for and understood by their healthcare providers experience better medical outcomes. They are more likely to adhere to treatment plans, experience less pain and anxiety, and have shorter hospital stays. For nurses working in the high-stress environment of the NICU, compassion is not a luxury, but a necessity. Empathy and kindness are not just about being nice. They are essential tools for preventing burnout and promoting job satisfaction. When nurses feel emotionally supported and valued, they are better equipped to handle the challenges of their work and provide high-quality care. Compassion creates a positive feedback loop in the NICU. When nurses feel compassionate towards their patients, they provide better care. This, in turn, leads to better patient outcomes, which reinforces the nurse's sense of purpose and job satisfaction. This virtuous cycle benefits everyone involved. Section 4. touched by kindness, real-life stories of compassionate care. The NICU is filled with stories that illustrate the profound impact of compassionate care. Many parents find themselves overwhelmed with fear and uncertainty when their baby is born prematurely. They often cling to the words of the healthcare professionals, finding solace in their calm demeanor and empathetic approach. Nurses make it a point to involve the parents in every aspect of their baby's care. They teach parents how to give their baby kangaroo care, skin-to-skin contact that helps regulate a preemie's temperature and heartbeat. Celebrating each milestone, no matter how small, with genuine joy, reassures parents that their baby is a fighter. These stories, and countless others like them, highlight the power of compassion to transform the NICU experience. For families facing unimaginable challenges, a kind word, a gentle touch, or a listening ear can make all the difference. Section 5. Beyond expertise. The indispensable role of kindness and empathy. Bulsara firmly believes that kindness and empathy are as integral to her practice as clinical expertise. This conviction underscores a fundamental truth about healthcare. While technical skills are essential, they are not enough. To truly heal and care for patients, especially the most vulnerable among us, healthcare providers must approach their work with compassion, empathy, and a deep respect for the human beings entrusted to their care. Kindness in the NICU can be as simple as taking the time to learn the name of each baby and their parents, remembering their individual stories and preferences. It's about speaking to families with warmth and respect, acknowledging their fears and anxieties. It's about celebrating even the smallest victories with genuine joy. Empathy, on the other hand, involves trying to understand the world from the perspective of the patient and their family. What is it like to be a parent facing the unimaginable fear of losing a child? What does it feel like to be a tiny baby hooked up to machines in a strange and overwhelming environment? By embracing kindness and empathy, healthcare providers can create a more humane and healing environment in the NICU. This, in turn, leads to better patient outcomes, increased job satisfaction for nurses, and a stronger sense of community within the hospital walls. Section 6. Conclusion. A legacy of compassionate care. In the high-tech world of the NICU, where advanced technology and sophisticated procedures often take center stage, it is easy to overlook the simple yet profound power of human connection. Bulsara's approach to care serves as a powerful reminder that compassion is not a sign of weakness, but a source of strength. By leading with kindness and empathy, healthcare providers can make a world of difference in the lives of vulnerable infants and their families. This commitment to compassionate care creates a ripple effect, fostering a more humane and healing environment for everyone within the NICU's walls. It is a legacy worth striving for, one that honors the humanity of both patients and caregivers.